Yes, sir, I'm starting.
Dr. Amulya Singh is our first speaker, and he is going to speak on how to improve the patience of the patient waiting in the waiting room of the OPD. Over to you, sir.
Thank you very much, sir. I'm really sorry that my video has some problems, so you have to bear with me, but audio is going on well, hopefully. And I'm thankful to the Maharashtra Orthopedic Association for giving me a chance. I came from Bombay today only at around 3 p.m. And I will be talking on this, improving the patience of patients in our OPD area. Generally, we all practitioners, whether it is only not only orthopedics, but any department, whenever we are practicing, our patients who are sitting in the waiting area, they are dissatisfied. Then I will coming, what is patience? Patience is actively waiting without complaint and grievances. This is not passively waiting, that is laziness, because those patients are not eager to meet us. And how come is patients informing us that patient is waiting for just the right moment before screwing someone over? Means once the patients of our patients get above the threshold level, they are ready to fight with us. This patience is derived from a Latin word pati, which literally means to suffer, to bear, to endure. And no wonder the Indian husbands are referred to as Pati Dev, Bichara Pati. How we feel when we are impatient? Yes, we are irritated, ignored, anxious, tensed, nervous, burned out. We are frustrated, stressed, and depressed. The charm, positivity, excitement is lost. And ultimately, we lose our tempers. This is happening in our OPD area. While sitting inside the chamber, we may not realize it, but similar is the feeling of our suffering patients. For consultation, patient has to go to different places in the hospital. Even in my hospital, which is only 75-bedded hospital, once he arrives at the OPD, he has to go to the reception, registration area. Then there are issue of token number. He has to sit on the waiting room before coming and meeting me as a doctor. Issuance of medical prescription, what I do right. Then he has to go to the labs, X-ray room. Somebody has to be there for counseling. Then he goes to the medical pharmacy, collects the medicine, and then goes back. This is a long, long travel for our patients. So patient may lose patients at all the places. So patience is not the ability to wait, but the ability to keep a good attitude while waiting. This was said by Joyce Meyer. And we as a clinician have to realize how to improve our patience of our patient. Hospital management does not realize the problems faced by the patient. What the management wants, that patient should sit quietly and wait without expressing anxiety, tension, or frustration. Patient should be always calm and considerate. They should not talk or shout in the OPD area. This is what management wants, but something different towards our patient. Negative consequences of being impatient, what is happening? Patient attendants get upset, easily lose temper. They ignore all the good work of the past. They start shouting. Staff and other patients get disturbed. Inside the chamber, the doctors get disturbed when they hear all those noise outside the chamber. There's further delay and confusion, and everybody is suffering now. The quality of care suffers, leading to bad reputation of our hospital. To lose patient is to lose the battle, what was said by Mahatma Gandhi. So generally, if our patients are losing their patients, we are getting the bad word from the society. Overall perception, what is happening? If generally what is said in the blue line is poor is 6%, but 60% are in good area. So if the patient perception is that 6% that's poor, or maybe only 18% which is satisfactory, more than 6% of poor perception sends a bad impression of hospitals. So mind my words, if 6 patients out of 100 are not satisfied, that is giving a bad image in our society. Find the problem. Sometimes it is hard to pinpoint exactly from our daily reschedule. It's creating problem to our patient and sending poor perception in society. So design a survey to identify your problems. Being a clinician also, you have to come as a good management expert so that you can find out where is the problem. What is happening? What is the reported data of complaints when patients are getting impatient? Generally in OPD environment, what you say, 60% time females are getting impatient and 40% time males are getting impatient. In reception and welcome, again, the female area perception is more of getting impatient. So we have to make a comfort at waiting area because our female patients want a comfortable environment. This is very important. And waiting time, it is more than 30 minutes. Then generally the ego of the male comes over and they are getting more impatient. The most important reason for losing patient in OPD area is the increased waiting time where the patients are waiting. Waiting time refers to the patient before a patient waits in the clinic before being seen by the doctor, means from the registration to final consultation. Patient clinic waiting time is an important indicator of quality of services offered by our hospital. Long waiting time leads to frustration and people get angry. What happened in my clinic 2 years back? This was being recorded in my CCTV, and what is this patient was waiting for more than 1 hour. Now he comes to the reception area, starts shouting. Yes, he is not happy because he's waiting there for more than 1 hour now. The staff sister tries to convince him that the doctor is going to see you after some time. But even this, other patients are till now, they are sitting but down. Now see, this percent is increasing. Somebody else is shouting. One patient dissatisfaction leading to more dissatisfaction. Other patients, now they are ready to rise. They are ready to shout. More number are joining. So the solution is to reduce the waiting time. Make sure the patient receive the right care at the right time. Be patient. Some things take time. In turn, this will improve patient perception and reduce the cost of care. So reduce the patient time, you will have more faith among your patients. Why patient fails? Because there is a gap between expectation and performance. Expectation of our patients and performance from our side as a clinician and as a management. So there is a small difference, delight. If you are able to fill this gap, then this is called delight and the patient is never impatient. So fill this gap between your expectation and performance. The Institute of Medicine recommends that at least 90% of patients should be seen within 30 minutes of the scheduled appointment time. If you are given an appointment of 10 a.m., make it sure you see it before 10:30 a.m. at least. Several studies have shown that patients spend 2 to 4 hours in the OPD before being seen by the doctor, and this is the most important reason for impatience and creates a poor perception of the hospital. We should try to get a balance between the demand and supply of appointments. Doctors can take advantage of web-based technology like an online check-in system that allows patients to wait for an appointment at a location of their choice. This is very important in this busy world. So e-patient portal can be designed, can be used to reduce the patient wait time. Patients have the opportunity to submit all the information beforehand, but make it very, very simple so the patient is able to fill it properly before he comes to your hospital. Encourage your patient to schedule their appointment for the early morning slot. This is very important. Why? Just like the first flight are usually on time, the morning appointments of the day are usually on time. Support staff behavior. This is very important because most of the time our patients are surrounded by our staff. All staff should be decent, well-mannered, caring, and supportive to the patient concerned. Have dedicated staff for easy responsibility, and this will avoid unnecessary confusion among your patients. Front office staff members are our first impression in the hospital and sometimes final impression. If the patient is not satisfied there, he may not come to your chamber. They reflect our professionalism. But request your reception area staff to be away from smartphones during office time. When our patients are waiting, they see their staff working with the social media, they get more angry. Make sure that the duty staffs report at least 30 minutes before the first appointment to avoid confusion. It should not be there that the patients are there, but the staffs are not present on duty. List of appointment along with the tentative reporting should be finalized and duly intimated to the patient doctor. Any last minute changes should be brought to notice as early as possible. If priority is to be given, because especially in Bihar, we have to be surrounded by politicians, press people, all those bureaucrats. The management should be transparent in this regard. Otherwise, other patients take it in a very bad way. Any delay should be announced by the public address system with due apology and regret from the management side. Many a times, even the doctor should address. Set a time limit for late arrivals. If a patient is more than 30 minutes late, let them know that he has to reschedule the appointment with some fine. And this is happening everywhere. All organizations like airlines, etc., are implementing this. Then why not the hospitals? The first impression of the hospital, our reception inquiry should be near the entrance. The OPD should be readily accessible. Signage should be displayed at strategic locations so that patients can know where they have to go in the local language. Washroom should be predominantly displayed and should be very, very clean like a five-star hotel. Waiting area should be large enough to accommodate the patients and attendants, especially in this COVID time. Proper arrangement for lighting and ventilation should be there. The waiting area should display general information of public interest so that patient can get involved, and somebody should be there for counseling them within minutes of their waiting time. Waiting area should be very comfortable with adequate facilities like TV, newspaper, Wi-Fi zone. This is very much required these days. A large aquarium with attractive fishes. This attracts children. Arrangement or refreshment that the patient can have some refreshment there, and pure drinking and safe water. Doctor interaction with patient attendant. The patient has waited patiently for so long, maybe more than 30 minutes. Now he may be impatient. Now when he's coming inside your chamber, talk to your patient with smile. This is very important. Unless you don't talk, the patient's anger will not subside. Make a good eye contact. Try to touch him. The human touch matters, and this will nullify whatever anger he has. Patient wants to interact with you, not your staff. So try to counsel him. Give your precious but precise time. You may not get the second opportunity if the patient goes unhappy from your chamber. Your body language approach can cut down the impatience of your patient. It has been proved beyond doubt that communication skill of a doctor is more important than his technical skill and knowledge to impress the patient. Even if patient was impatient after a long time, this art of communication, of good communication skill from the doctor and human touch can bring back the patience of that patient. So the valuable time of a doctor should be focused on interacting with patients and examining. Try implementing a team care model where a clinical assistant takes on some additional documentation tasks before he or she enters your chamber. Each minute is precious. Utilize your time judiciously to satisfy and convince your patient. Many a times your counseling staffs are there. Our sweet and short interaction with patients and the attendants may not satisfy. So have a good counseling staff which can counsel and satisfy your patient. Have a good team of trained, polite, and humble counseling staff who are ready to solve the remaining queries, because you cannot be there for long with your patients. Patients can come for opinion by our marketing efforts, but retaining them as permanent patient is a big art. For this, reduce the impatience of your patient. And how can you succeed? Satisfying all patients and removing their impatience being an impossible goal for now, but cutting them down is always possible. Remember that lots of patients are bad signal which brings bad repute of your practice, and there is risk of losing revenue and patient. You have built a big empire. Don't lose your patients because they are getting impatient. So listen carefully, be responsive to their whatever needs, understand the needs, expectation of your patient, work on your brand image of your hospital, encourage the patient feedback, measure and try to improve whatever drawbacks were there. Being a successful doctor is more about maintaining patience of our patients than our own skill and knowledge. Care more for the individual patient than for the special feature of the disease. Put yourself in his place. The kind word, the cheerful greeting, the sympathetic look, these the patient understand what William Osler has said. So focusing on patient satisfaction, what you do, patients will come and go. Some will test you, some will love you, some will leave you, some will bless you. But as a doctor, be patient and bring the solutions so they are always happy with you. So for this, communication skill of the nurses, communication skill with doctors, communication about medicines, responsiveness of hospital staff, how to properly management. This is very important. Orthopedic surgeons, clean and quietness of the hospital environment. Discharge instructions should be in detail, and overall hospital rating. These all matters for our patient satisfaction as such. So if advantage of patient satisfaction, if the patients are satisfied, they bring good number of patient. This is the total quality management. If one of the patient is not satisfied, that reaches 4 new patient. But if you disappoint one patient, that reaches 10 potential patient, and there's a big loss. A man who is master of patient is the master of everything else. This was said by Lord Halpin. And we as a doctor have to realize that we have to maintain a good patience of the patient for very, very successful outcome as a good clinician, good doctor. Thank you very much.
Thank you, Dr. Amulya Singh, for that wonderful talk. It is rightly said,